using a blood sample, but some can also detect antibodies in saliva or urine. These alternative methods offer more flexibility and convenience for patients. Another type of HIV test is the antigen/antibody test. This test is more advanced and can detect the virus earlier than antibody tests alone. This test can detect both HIV antibodies and a specific HIV protein called P24 antigen. The presence of the P24 antigen indicates an active infection. The P24 antigen appears in the blood soon after infection, even before antibodies are produced. This makes the antigen-antibody test a valuable tool for early detection. Lastly, there are nucleic acid tests, or NATs. These tests are highly sensitive and can detect the virus directly by identifying its genetic material. NATs directly detect the presence of HIV in the blood. They are particularly useful in cases where early detection is critical, such as in newborns or individuals with recent exposure. These tests are very accurate but also more expensive than antibody or antigen/antibody tests. The cost factor can be a consideration for many patients and healthcare providers. Understanding the different types of HIV tests is crucial for determining the appropriate test based on individual circumstances. Each test offers unique benefits and limitations, and choosing the right one can make a significant difference in the management and treatment of HIV. Fever is often an early sign of HIV infection. During the initial stages of infection, known as acute HIV infection, the virus rapidly replicates within the body. This triggers an immune response leading to a cascade of symptoms, including fever. Fever during acute HIV infection is typically mild to moderate and may be accompanied by chills, sweats, and muscle aches. It's important to note that fever is a non-specific symptom, meaning it can be caused by a variety of illnesses other than HIV. If you experience a fever along with other symptoms such as fatigue, sore throat, swollen lymph nodes, or skin rash, it's crucial to consider the possibility of HIV infection, especially if you've engaged in high-risk behaviors. While fever is a common symptom of acute HIV infection, it's often accompanied by other telltale signs. These signs can be subtle and easily mistaken for other illnesses, making it crucial to be aware of the full spectrum of symptoms. These symptoms typically appear within 2 to 4 weeks after exposure to HIV and can last for a few days or several weeks. The timing and duration of these symptoms can vary greatly from person to person. One of the most frequent symptoms is a skin rash. This rash can be one of the earliest indicators of acute HIV infection. The rash associated with acute HIV infection can vary in appearance but often presents as small, flat, red spots on the skin. It can appear on any part of the body but is most commonly found on the trunk. It may also manifest as itchy bumps or blisters. These skin changes can be uncomfortable and may be mistaken for other skin conditions. Other common symptoms include sore throat, swollen lymph nodes, headache, muscle and joint pain, and fatigue. These symptoms can be similar to those of the flu or other viral infections. Some individuals may also experience nausea, vomiting, diarrhea, or night sweats. These gastrointestinal symptoms can be particularly distressing and may lead to dehydration. It's crucial to remember that not everyone experiences all of these symptoms, and some individuals may only have mild symptoms or none at all. The variability in symptoms can make acute HIV infection challenging to diagnose without proper testing. However, if you experience any of these symptoms after potential HIV exposure, it's essential to seek medical attention and get tested. Early diagnosis and treatment can significantly improve health outcomes and reduce the risk of transmitting the virus to others. Fever is a common symptom of many illnesses, including the common cold flu and urinary tract infections. It's essential to remember that fever alone is not a definitive indicator of HIV infection. Many factors can cause fever, and it's important to consider your overall health, recent travel history, and any potential exposures to infections. If you're experiencing a fever, it's always best to consult a healthcare professional for proper diagnosis and treatment. They can evaluate your symptoms, medical history, and risk factors to determine the most likely cause of your fever and recommend appropriate testing if necessary. Section 6. High-risk encounters and the fever factor. When to get tested. HIV transmission primarily occurs through unprotected sexual contact with an infected individual, or sharing needles or syringes with someone who has HIV. If you've engaged in these high-risk behaviors and develop a fever or any other symptoms associated with acute HIV infection, it's crucial to get tested as soon as possible. The window period for HIV testing refers to the time between potential exposure to HIV and when a test can accurately detect the virus. During this period you may have contracted HIV but test negative because your body hasn't produced enough antibodies or antigens to be detected. If you're concerned about a recent potential exposure to HIV, talk to your healthcare provider about getting tested. They can advise you on the appropriate testing timeline and available testing options. Section 7. Early detection, the cornerstone of effective HIV management. Early diagnosis of HIV is paramount in ensuring timely access to treatment and preventing the progression of the virus. When HIV is detected early, treatment with antiretroviral therapy, or ART, can significantly reduce the amount of virus in the body. ART helps to control the virus, preventing damage to the immune system and reducing the risk of developing AIDS. Early initiation of ART has been shown to improve long-term health outcomes for individuals living with HIV. Moreover, early diagnosis and treatment can help prevent the transmission of HIV to others. ART can suppress the viral load to undetectable levels, meaning the virus is effectively untransmittable to sexual partners. Section 8. HIV testing, a gateway to prevention and support. HIV testing is an essential component of public health efforts to prevent and control the spread of HIV. It is a critical step in identifying individuals who may be living with the virus but are unaware of their status. By knowing their status, individuals can take the necessary steps to protect their health and the health of others. Regular testing allows individuals to know their HIV status and make informed decisions about their health and the health of their partners. It empowers them to take control of their health and make proactive choices. Early detection can lead to better health outcomes and reduce the risk of transmission to others. For those who test negative, HIV testing provides an opportunity to discuss prevention strategies with their healthcare provider and access resources that can help them stay HIV negative. This includes education on safe practices, access to condoms, and information on other preventive measures. This may include pre-exposure prophylaxis, or PrEP, a medication that can significantly reduce the risk of HIV infection when taken as prescribed. PrEP is a powerful tool in the fight against HIV, offering an additional layer of protection for those at higher risk. For individuals who test positive, early diagnosis allows for timely linkage to care, support services, and treatment. Early intervention can improve health outcomes and enhance the quality of life for those living with HIV. It also helps in managing the virus effectively and reducing the risk of complications. It also provides an opportunity to connect with others living with HIV and access resources that can help them navigate the challenges of living with the virus. Support groups, counseling, and community resources play a vital role in offering emotional and practical support, helping individuals lead fulfilling lives despite their diagnosis. Section 9. Your health, your priority. Taking charge with HIV testing. HIV testing is a crucial step in taking control of your health. It empowers individuals with knowledge about their HIV status, allowing them to make informed decisions about prevention, treatment, and their overall well-being. Remember that HIV testing is confidential and readily available. You can get tested at your doctor's office, local health department, or community health center. Many clinics also offer rapid HIV testing, which provides results within minutes. If you have any concerns about HIV or your risk of infection, don't hesitate to talk to your healthcare provider. They can provide guidance, support, and access to the resources you need to stay healthy and informed. Your health is your priority, and taking charge of your HIV status is a powerful step towards a healthier future.